Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people you do business with. And today we're joined by Michael Kaszubski, the co-founder of Home Team Mobile Diagnostics. I think I actually got that name right. Did I pronounce that right, Michael?
Absolutely.
Wow.
Took me till I was 8 years old to figure it out, so you're doing well.
Well, and with Armbrushmaker, my kids get a good head start. They have half the alphabet figured out by kindergarten. So
there we go.
That works out good for them. Well, practice makes perfect. I'm glad I got your pronunciation right. And, anybody that's followed my podcast or listened to it, you can see a pretty common theme that I love to find unique and innovative business ideas that have been formed. And this is right up there with some of the best ones I've seen so far. And all started with a whiteboard back in 2012 and an idea. And now here we are in 2021. It's evolved into a business that covers a big part of the state, served over 23,000 people last year. Michael, tell people what the heck it is you're doing and how this idea evolved.
Oh, great, Ryan. Well, thanks for having me on the podcast. I really appreciate it. And the chance to tell the story, because this is one of those businesses that most people haven't heard about. We do portable x-ray, ultrasound, and echocardiograms, which everybody knows what those are, but the difference is we come to you. We do them in your house, your living room, your nursing home room, your assisted living, your apartment. We can do them in your office, at a lunchtime break. And so the convenience of driving that into a patient's home is fantastic. It's far less expensive than going to a fixed site facility. The copay is there. Most insurances, or almost all insurances, cover it. And to give you an idea on how little it's known, the business has been around 30 years. We've done lots of roundtables. 75% of physicians have no clue that they can actually have the patient have this performed in their house, and 95% of people have no idea that it's even available to even ask their doctor. So, on a typical example, you go to your doctor, they say, hey, we should probably follow up with ultrasound or a test to see if you have a blood clot. And if it's not done the same day, you're scheduling another appointment and trying to coordinate that. And people just don't know it exists. So it's definitely back in 2012, we looked at a model that we were familiar with, and we thought, we think we can do it different and a little bit better than it was out there. Started with a whiteboard. So same old story, came into it and said, okay, have enough funding to get off the ground. And I remember the early days, we whiteboarded this thing out. Took us all of pretty much 2011, part of 2012, and from 2012 to March of 2013, we just started building the structure. Got it ready. March 18, 2013, turned it on with 2 employees, a volunteer call center person, myself, and my partner, and 2 trucks, 2 x-ray pieces of equipment, and went, wow, I hope the phone rings. And really went out to the, started, old fashioned, right? Grassroots, knocking on facilities and assisted livings and talking to doctors. And we had both come out of healthcare, so we had some contacts, and, but what we found was all of our contacts had no clue how this worked, right? It's a new model to them. They had no idea on the safety of it. And so we had to explain to them, we're doing hospital quality in a living room. And when you haven't heard that before, and most people probably listening to this podcast are going, how do you do that? Well, the x-ray piece of equipment fits in the back of a Jeep. I mean, our original 2 vehicles were Chevy HHRs. A little funny side story on that. We the very first one we bought was kind of a souped up HHR that had a skull on the door locks all the way around it, and we didn't know it when we bought it, because we bought it as a used car. And so my first x-ray tech, who's still with us, by the way, so she's our longest term employee, was there on day one. goes out to the car the first time, and then she calls us from the road and says, "Hey, it's really cool. You guys themed it out that it's an X-ray machine." And we're like, "Yeah, no, we that was totally unplanned." So, we have this like legends and lore about how the company started. Just and we're up to, I think, 41 employees now. We have 25 vehicles. We have, we have an office in Grand Rapids. We have one in Sterling Heights. We're based in Southfield, and we really cover pretty much the entire state of Michigan. Some limited area geographically way up north. We're all trying to vie for that Traverse City location so we can spend the summer up there. But like I said, 23,000 patients, like you had mentioned, do a lot of good for a lot of people.
Just fantastic story. And I think the thing that I like too about it, of course, all your x-ray techs are certified. So you're not just hiring people to try to meet the demand, you're making sure you're hiring the right people. And then the results you get come quickly, but they're also high quality results. They're not, you're going to get an actual reading. It's not just something that's rushed through.
Yeah, absolutely. So our X-ray techs are all certified. We have echocardiograph technologists; they're all certified, and our ultrasound and vascular techs are also certified. So same employees you would get at a hospital are the same ones we hire. They have just decided that they want to be in the mobile world and come to you instead of being in the same fixed site location every day. But it's the same level of service. We use all our cardiologists and radiologists are licensed. They're all U.S. based, so that's always something that we get asked. How is this different? You use an offshore physicians? Nope, we use everybody's licensed and board certified in the state of Michigan. Our chief operating officer is actually a cardiologist and radiologist both. So he's been with us for about 10 months. And so we have an internal physician that oversees everything as well. So from quality down to even just providing our technologists with live, training and quality, improvements as we continue out through. So it's really it's about the patient first, servicing their needs, and then in a high quality and a highly, safe environment.
So give me an idea for people that are listening to this. What are some triggers where they would need your services? What are some of the common themes that you've seen on some of these calls that you've had to go on?
So a lot of times, so we do a significant number of geriatric patients. So people recovering at home, they've had surgery or they're elderly and they're homebound, limited access to move around. On an X-ray side, it can be anything from, they have some congestion and the physician wants to see what's going on in their chest, to they were in the middle of the night walking through the house and fell or bumped into something, and so we get a call to go take an X-ray to see if they need to, if they broke anything. Do a lot of cardiac exams for, heart conditions and COPD, et cetera. And a lot of it, to give you an idea of how fast the service is, if a physician, let's say a patient, or their caregiver or family member, it all starts with the physician coming to us, but somehow a physician calls us or sends us over an order. From the time we get that phone call to the time that the ordering physician receives the result to tell you what's going on is anywhere between 4 and 6 hours. So I can give you a story about why that's so important. And I had this with one of our neighbors who had an elderly parent living with them, and they were both working. And they work about 45, 15 minutes from the house. Parent, during a home care visit, had a situation that they felt that they needed an X-ray. And so by the time my neighbors could have gotten back to the house from work, got their parent in the car to take them to a setting where they could have had it done, plus the wait time, and then getting them back home, etc. That's what a 6 to 8 to 9 hour day disrupted everything and the whole continuum of the family. Everybody's running around trying to figure out, and you're trying to figure out how to get an injured person, potentially injured person, into a car. and get them to a location. We were there and done before they could even get to the house and figure out whether or not, they had the ample opportunity to get them there. And if you call an ambulance or you do an emergency, and once again, we're not an emergency service, so once again, this is why the physician makes a decision. If it can fit into the model, then we're there. But otherwise, you get transferred. But people know an ambulance, is a very expensive way to get back and forth from the hospital, even if it's a one-way trip. So this is significantly less.
Yeah, you kind of a little bit answered a question that was on my mind. So when you get these results back and you see something that is an emergency situation, I would imagine you, as quickly as possible, relay that to the doctor. And then, I mean, you're out of it at that point, right? But do you
Yeah.
try to push them to get there as soon as possible, I would imagine?
Yeah, so what ends up happening is they get so they'll be alerted at the same time we are. So we place a phone call to that ordering physician. Plus, we have some that get an electronic alert themselves because they have access into our system. So the electronic alert tells them, "Hey, you need to look at this patient right away." But usually with our phone call, our system is automated, so the interpreting physician's usually getting the result and at the same time we are, and they're way ahead of the game. So by the time we call them, even if it's within 10 or 15 minutes of us seeing it and getting out to them, they've already reacted to it. So it's a very quick turn. And it's used as a tool not only for the home setting, right? So here's how the medical community uses it. The industry, for how it was incubated or how it's been around forever, really started with skilled nursing facilities. The idea was, if you remember, 20 years ago, skilled nursing was where everybody went and you stayed. And the idea was you didn't want to transport them back to the hospital because nursing homes um, lose money when a patient has to leave the building for the day because they get paid per day that they're there. And so the idea was, hey, let's keep them here and then let's extend as many services from a comfort standpoint too, right? You're an elderly individual, you don't want to get exposed to anything unnecessarily that you don't have to. And car rides and trips are uncomfortable. I mean, it's just all around, it's a better care setting if you don't have to leave. So nursing homes use it as a way to as a convenience for one, a cost savings as another, and then really, probably the most important thing is from a patient comfort and protection standpoint. And then as the years have gone on, so back when we looked at this model in 2011 and 12, we saw that there was the start of the shift of healthcare going to people recovering in home. So at the time, you would have heard us speaking in 2011, 2012, geez, it's going to be mid 2020s before, 2025, 2026, when we believe that the market understands as the baby boomers get older, they tend to like to stay at home. And the kids coming up are busy, two income earners, they have children themselves, kids are playing after school sports, there's limited amount of time. And so people say, hey, I got 3 weeks vacation, 2.5 weeks are taking care of my parents med, our med, and our kids meds. And so we get a half a week vacation a year. And so we started seeing this, what we call a three convenience generation side. And in the last few years, home care has started to increase. And COVID is terrible, but it's also a catalyst that then provided people to understand that care can be provided in a different setting nowadays, right? 2 years ago, you and I talking, people are still used to going to traditional buildings, et cetera. Now we come into now, and what is everybody used to? Telehealth exploded, right? Significant double-digit increase in telehealth. New technology, just what was introduced at Consumer Electronics Show this year, shows that a lot of vendors are preparing for this shift to be able to do things at home. I mean, Abbott has a patch, a little micro needle. You put it on your arm and you can test your glucose and send it to your doctor live. So we're going to start seeing a lot of that stuff come in. And we were always, always positioned to get to that point. And our biggest barrier is education and knowledge that it exists, right? So we've now found that physicians are reaching out because their patients are, they're sitting at home. They're not coming into, the physical setting anymore. And so as we get that word and that messaging out and we educate the public, really, that's the other thing, is to say, hey, can I have this done here? And talking to your physicians like anything else, is this drug right for me? Is this procedure right for me? And then, we're just trying to get people to understand that there's an alternative. And we just signed a deal last week with a national telehealth provider that we're going to be working with them to position with large employers. They're called Easy Access MD. Their model is to look at self-insured providers and help them reduce the costs within their insurance program, since they're paying for it themselves, by using tools like ours as a strategy into cost reduction. But also, if we can do it while the employee's at work on their lunch break or during the day, and they never have to leave, and all they find out is they need 2 aspirin and a bandage, and they can continue on with their workday, it's good for the employee. It's a fast response, and at the same time, it's designed to keep the cost as low as possible while the quality level is maintained.
I love it, man. It's a win-win for everybody all the way around. So, people can save money, like you said, between the assisted living facilities and the patients, and insurance covers a lot of this, because sometimes I find with some of these new medical technologies, insurances are slow to get on board, but there's no issues with that part of it. And you're still evolving. You're trying to add new layers to the business to be able to do more. So there's unbelievable amount of potential, I think, for what you're offering here. So tell me, you already kind of shared a good story, but maybe to kind of close here on a high note, tell me about how this makes you feel, what you've been able to do to help people out, or if there's maybe another story you'd like to share that people would be interested in hearing.
Yeah, it's so our the feeling part is great, right? Because we have, with having treated the number of patients that we have over the years, I could go on for hours and hours and hours about different stories. There's a common theme in what we have, is because we're able to go to the patient and because we're able to do it quickly, it relieves a lot of anxiety from, either the parents or, a lot of times, since we're doing geriatric, it's the kids. And what we share a story with you. We had an individual was frantic, happened to know that we did the care and asked the doctor to reach out to us by virtue of one of her parents' friends had the service done. And so they were just talking about it. And then her mom happened to have a situation that required an x-ray. She fell in the middle of the night going to the restroom. Reached out. The physician said, hey, we'll try to figure it out. Well, the daughter knew about us, and she was out of state. None of the siblings are in state. Mom's now fallen. Dad has passed away, so she's in a frantic mode. Called at 11:30 at night, and we're a 24/7, 365 operation. So calls at 11:30 at night, frantic. We're talking to the daughter. And we try to make it as easy as possible. We always need a physician order, but in this case, our patient registration, asked her who the doctor was, reached out to the emergency service, coordinated the whole thing, sent over one of our techs. We rerouted somebody over there because we have people on the road, got the exam done. And I think we did it. We happened to be close enough. We did it in record time, like an hour and a half. And it wasn't so much that we did it quickly or that we did it in the manner that we did. Everybody, our team worked to put the patient first, which is what we always say, patient first. But the appreciation we got back from the daughter, that very next morning at 6 a.m. saying, "Oh my God, I couldn't sleep last night because I was so worried." And I was able to go to bed at 1 o'clock in the morning and not worry about my mom because I knew she wasn't hurt and didn't have to go to the hospital and didn't have to have surgery. And, you know how somebody's mind works, right? Broken hip. And so everything got taken care of. And that is the rewarding side of this business. That is where, that's why we did it. My partner and I did this because we want to make a difference for society and move things where it should, and continue to put that through and disrupt healthcare, right? In essence, we're healthcare disruptors putting in a new model, and there's that challenge to do it. But the rewarding piece is it's the equivalent of that virtual hug you get from your kids when you're out of state, right? We can go home at night and say, just had a really touching moment, and made it all worth it. So all the headache and running into the barriers and something, when you can see the positive impact that you put on somebody's life and to eliminate that anxiety, because it's something we all can relate to, right? We all have been there. And if somebody could just relieve that pressure valve, that appreciation is there. And that's why we do it, to make other people's lives a little bit easier.
Just awesome stuff. And I'm so glad to have you on, because the key, like you say, is letting people know this is available. So there's many more people out there that could use your services that just don't even know that it's available. So hopefully through this podcast, we help continue that awareness of what you do. So for those that are listening and interested and maybe need your help, what is the best way to schedule an appointment?
So the best way is to ask your doctor to give us a call. But once again, we're going to make it as easy as possible. So the number is 888-519-9103. And you can talk to our patient registration. We'll take your doctor's information. We'll coordinate it with them for you. Or if you're speaking with your doctor, just give them that information. You want to check out what we do, it's htmobilediagnostics.com is the website, and that'll allow you to kind of see, basically the wide range of services that we do. We offer, some private pay stuff, which is also available, but that's just easier to give us a call and we can talk through that.
Very good. Well, again, thanks so much for coming on. We may have to have you on again down the road. You keep evolving and changing. You'll probably have updates as we go here, but this was a great starting point. So appreciate you joining us, Michael.
Thank you, Ryan. Thanks again for allowing us to get on and share our story.
Absolutely.